Hello, everybody. This is Rick Greenfield. Thank you for joining. We're right at the top of the hour here. I'm going to just wait like a minute or 2 minutes to let a few others join, and then we will get started. But again, thanks for joining and hang tight. All right, everybody, just going to wait one more minute, let a few others join, and we'll be starting shortly. All right, well, it looks like the logins have slowed, so we'll go ahead and get started. Thank you again for joining our webinar today. I also want to give a special thanks to Marina Martinez, who has helped to put all of this together, and look forward to presenting for you all today. It'll just be me today. With these recent spikes in COVID cases, ImageBloom has gone back to fully remote operations, and we're kind of scrambling to be remote again. So I signed up to just do this presentation by myself, and so hopefully it goes well. It is kind of weird just talking and not receiving, but we'll get started. So today we will be talking about building and remarketing to your research database. I'm Rick Greenfield. I'm the COO of ImageBloom Incorporated. We're a full service marketing agency. My history is I used to own a very large multi-specialty clinical research site. And really what I want to talk about today is what all the different things that we used to employ and we actually help sites today employ through ImageBloom to be successful in building a site database and then remarketing to that database, which can be a pillar of your success as you grow and to help you be a strong and rolling site. So I thought I would share a lot of those tactics with you. These presentations are not intended to be sales pitches for ImageBloom. I want to make that clear, although at the very end, I do just kind of mention that we can help with these things. It really is, my goal is to inform and share some knowledge I think that I've built up over the years in this particular area. So I hope you learned something. Maybe at the end, I can learn something from you. We'll open it up to questions and even ideas. If you are doing some things that have worked for you, I know that we would all love to hear about them and share those with the group. So today, our webinar objectives will be understanding the importance of database building and remarketing, learning many methods on how to build a robust and powerful database, and then understanding how to implement remarketing tactics to stay connected to your volunteers and fast track enrollment on your studies. That should say studies. So we'll definitely talk about a lot of different methods to not only build, but then that remarketing aspect as well. So we're going to start with a poll question. And the question is, do you have a systematic and organized approach to building a robust patient database for your site or site network? Marina, can you start it up? There you go. And so the answer, the options are yes, here to pick up a few more tips. No, we haven't put much emphasis on database building, or we do some database building, but could probably do a lot more. So enter in your answer. And Marina, let's see the results. Okay, So good news. So 60% of you say that you are performing different approaches to building your database, but would like some more tips. 40% say you do some, but could do more. 0% saying that they don't do anything to build a database. So that's really good news for sure. And so Marina, there you go. So I'll click past that. So let's talk about why building your database is important. Perhaps you already know this, but it's always nice to sort of review. And even building this presentation, it was good for me to really review and think about all of the different reasons that we need to do this. And then of course, thinking about the different methodologies to build your database. But I do believe that high enrolling sites, especially the multi-therapeutic sites, have a large large cultivated databases to enroll from. I put multi-special in there because I do sometimes see sites that are focused maybe in just one therapeutic area, like a GI site. They pull from their EHR, EMR database. That makes up 80% of their enrollments or more. They're very lucky, in my opinion, that they are able to pull patients directly out of their practice and be very effective with that. My experience was that patients that came from doctors and the doctor's own EMR systems represented less than 10% of our patients in most cases, and in some cases 0% of our patients. So we really, as a site, as a standalone site, had to work very hard to learn how to leverage our database that we built over the course of many years, and of course all kinds of other marketing tactics to be successful with enrollment on our studies. But the one thing that helped me sleep at night was knowing that we did have a very robust patient database. And when I left the site that I had, we had over 130,000 people in our database, which comparatively to other sites is pretty large. So that's kind of the end goal here, is to get you over that 100,000 mark and grow from there. Utilizing your own database, you can build a name and brand your community. So that's another benefit, of course, is as you have this database, you can continue to leverage that database. And that's really the remarketing side of it, where you can really get your name imprinted into the minds of the people that have volunteered for your studies. And that's, the law of sevens in marketing, that we want to have numerous impressions going out of the marketplace. But who better to target your impressions to than the people that have already expressed an interest in your clinical trials? I always like to say that it's a statistic that the Tufts Center came out with at one point in time. Ken Getz, he basically was saying that through their research, they discovered that only about 15% of the population is even willing to participate in a clinical research study. So if you have a database of people that have volunteered for your studies, I like to say you're capturing that 15%, and now you can remarket and brand your company and provide them with lots of great impressions about your company. So you can stay connected and develop a relationship with your database of volunteers. And those relationships build trust in your community and increase the likelihood that people are going to consider your site for studies. They might see study opportunities from other sites in the area, but you have a presence. They see your name all the time. You're a trusted name in the community. Chances are they're going to be more apt to respond to a study that's happening at your site and be more willing to provide consent and actually participate. And then a robust database adds value to your business, and it's an asset. So if you have a clinical research site with 130,000 cultivated patients that are not just names and addresses, but actually you have all of their medical history and study history in there, and you've cultivated these relationships, there's a ton of value there for your business. So primary tools. Digital social media engagement is probably one of the biggest and best ways to grow your database. Social media, digital media strategies are the most affordable, at least in my opinion, and certainly what we do day in and day out at ImageBloom. We pretty much prove that the ROI from these channels exceeds anything you can get from traditional advertising channels. But so that is really, this is targeting more towards the social media aspect, where you're posting daily on your Facebook feed or Instagram, and maybe performing or executing on light campaigns, but really just disseminating information about your business. That could be everything from who your doctors are and why they're passionate about research and health, and staff pictures, talks about posts that talk about clinical research and the benefits to the community for participating. And then of course you can also showcase your studies on there. But there's other forms of advertising as well, any other channel that you could utilize, which could be newspaper, television. All of these different paid advertising strategies are going to give you opportunities to collect many, many more leads. And hopefully every single lead that you're receiving from these paid advertising channels is a lead that ends up in your database and someone that you can start to develop a relationship with. I always like to say that when someone applies for a study, they probably have maybe a 1 in 50 chance or 1 in 20 chance of qualifying, depending on the study, right? And so the most likely outcome is that they apply and they don't qualify. So making the most out of that new relationship so that you can perhaps get that volunteer into a future study that they do qualify for is really the goal here. Obviously, there's community outreach events. I don't know that any of those are really happening much anymore. Health fairs, but webinars is another option that you could consider in this time, especially where large gatherings are not really permitted or not a good idea. You could do webinars within your community that talk about research and health and get, promote it and get people to join. And that would be just another way for you to develop relationships. EHR, EMR mining. So a lot of folks sort of, I think, misconstrue, in my opinion, the difference between a research database and an EMR, EHR database. And they're just not the same. Again, that 15%, when you have an EMR database, your doctor might have 100,000 patients in there, but theoretically only about 15,000 of those folks would even be willing to participate in a clinical study. And if your doctor specializes in a certain field, then maybe very few of the patients are going to qualify for another specific therapeutic area or indication. So we're talking about developing a research database. So typically what we see sites doing that are successful is they're leveraging their EMR system to locate potentially qualified subjects and identifying that subset of subjects and then contacting them. And then as they reach those folks and assess their interest and determine if they might be, really assessing their interest is the top thing. If they are interested in research, you should go ahead and probably add them into your research database. But then from there, if you would collect and transfer that medical history information over into your research database, typically a CTMS, where you would have the medical history information to be able to leverage for future subject criteria on matching searches. So that's what I mean there by the EMR, EHR mining. It's pulling out that subset of patients and moving them over into your research specific database. Doctor referrals. So ImageBloom has a mobile app. I know other companies are coming out with mobile apps that make it easier for doctors to refer. So I highly suggest utilizing those when you can. But anyway, you can get your doctors to refer. Those are like little golden nuggets. Anytime a doctor refers a patient, there's such a greater chance not only that the patient's interested in participating, but there's obviously a greater chance that the patient qualifies because hopefully the doctor's done at least some review of the inclusion exclusion and feels like the patient's a good match. And then there are other referral and incentive programs out there, refer a friend programs and things like that that you can also consider to help bring more people to your site that are interested in participating in a future study. And so, within each of these bullet points here, there's a whole nother conversation and a strategy that goes along with making sure that those are being leveraged. But unless I left something out here, I felt like this covered really kind of the main pillars of areas that you can focus on to generate leads and interest and help really start growing and building that database. So I talked a little bit about the digital social media engagement aspect, but just wanted to kind of dive in a little bit into what that means. So they really do give the ability to target and connect with your community. So if you're running slightly promoted campaigns, you can promote those campaigns to people that have a higher likelihood of qualifying. An easy example is if you're running a women's health study, you can focus your ads towards women. Certainly age groups, other interest groups, so you can be more targeted with online social media marketing. There's also digital keyword search, and this is more paid unless we're talking about SEO for your website and making sure your website is keyword optimized, which can be very helpful. But you may want to also consider running some Google campaigns on some specific keywords so that you come up as a promoted or sponsored result. And this will really help you tap into other layers of the community that are not just on social media. I myself, I'm an N of one, obviously, but I have other friends and family that are, I think, in the same boat as me, where I really don't use social media that much anymore. I check it here and there. It thankfully is a smaller portion of my time in my life these days. And so I think I fall into the group of the community that probably wouldn't see a lot of ads on Facebook or Instagram. However, I still use Google every day. And so I think by doing some of the keyword search types of activities, you're going to tap into that population that's maybe not really heavy on social media, but you're still able to get ads in front of those people. And then a budget allocation each month into what you're going to put into these strategies is a long-term investment, because it is hard to gauge ROI, especially if you're doing more general types of things, talking about we're a women's health site or we do lots of studies. Give us a call to find out more about participating in a study. Anything like that obviously is not so targeted. It's a very wide net, but you're building that database, you're growing your database, and you're building your future essentially. So I think to think of it as a long-term investment that pays dividends in the future is a good way to do it. But you're going to need a budget. You're going to need to develop a strategy to go along with it to be successful in these types of campaigns. So this is a graphical depiction essentially of all the different ways that you can get leads coming into your database. Oftentimes your database again would be a CTMS, and some CTMSs can do more than others. But if you can leverage your website to have your studies on there in a way that when people apply, those automatically come into your database, that can be very powerful. You would have landing pages and information about your studies in a way that is mobile optimized, and you can drive social media traffic. And so a very important distinction here is traffic versus lead generation. And so if a traffic ad is essentially a free, or you could have a promoted post either way on one of the social media channels or any other platform for that matter, but what you're providing them with is a link that takes them to your website, and not just to your website, to a specific landing page about the study that you're hoping to find volunteers for, which would include a form that they can complete, and then that would bring them directly into your database. And from there, your staff would follow up. So that's one form. Facebook lead generation is a very specific form of lead generation that you can do in Facebook and Instagram. And if there are ways to link that up as well, potentially to your CTMS. Traditional media, television, radio, billboards, most people don't have automated ways for those leads to drop into their system, although there are systems that can do that as well. But the bottom line is that is still an opportunity for you to connect with folks and then add those names into your database. And text and MailChimp down below, you'll notice that those are double arrows, because essentially those are two-way streets, two-way forms of communication, where we're really leveraging the MailChimp campaign for mostly remarketing to our database, but that remarketing activity still gives us another opportunity to put links in front of people that they can click to apply for studies, and then those applications can come right back into your CTMS or database. Text messaging, same thing. That's a two-way form of communication. You can send texts out, you can receive messages back in. And then the mobile app, as I mentioned, ImageBloom has a mobile app especially for this purpose, but there's other mobile app services out there that you could possibly look at to help you. It's really more for doctors and staff to be able to easily refer patients directly to you. So another question. We're now moving to start talking a little bit more about remarketing. Do you currently remarket to your patient database? Answers can be yes, we utilize multiple remarketing tactics. A little, we do a few things. And the last one is, what is remarketing? I'll give you just a few more seconds. All right, Marina, let's see the results. Awesome. So this is great. Well, I don't know if it's great, but 0% say yes, we utilize multiple remarketing tactics. 57%, a little, we do a few things, and then 43% not sure what remarketing is. That's why it's great, because I'm gonna tell you what remarketing is today and tell you how important it can be. Oh, so I have to click on my screen to make it go. There we go. So I guess I'll answer the what is remarketing. So essentially, if I'm running ads and I'm trying to lead generate and get people to respond to my ads, that's the first time I likely have heard from somebody. They might be applying for a second or third time, but in many cases, it's the first time I've made a connection with somebody. It's the first time they've reached out to me. And then of course your staff should be following up and screening them perhaps over the phone and trying to get them in the study. But as I mentioned, 1 in 50 chance probably that they don't qualify. So you tell them, thanks for your application, you didn't make it in. We'll contact you in the future. That future contact is remarketing, but that remarketing can be so many different things. It could be picking up the phone and calling them again a few months later. It could be sending them emails that are, monthly newsletters. It could be sending them targeted emails because you, based on your previous phone screen, determined that they didn't qualify for that study, but then now they qualify for a new study. And so you're going to send them a targeted email or text message to see if they want to participate in this new study. And then there's tons of other ways to remarket as well, and we'll talk about that. But the remarketing is an opportunity for you to build a relationship and loyalty with those willing volunteers within your community. And so if it's just a one-time communication, obviously you don't really have too much opportunity to build a conversation other than that one touch, that one discussion or phone screen that you have with them. But as you continue to reach out to them and continue to provide them with information and impressions about your site and your studies, they get to know you, and hopefully over time you get to know them. So the nice thing about remarketing too is it's extremely inexpensive in most cases, and it's extremely effective because again, you're talking to that 15%. You have collected in many cases their medical history, their general medical history information. And so by reaching back out to them, you've already determined that they're interested in research, and you already know at least their demographic information and probably their primary diagnoses and maybe even their medication. So you have a pretty good idea that they're a likely qualifier. But it adds a lot of value to your followers, and especially if you're disseminating really good information about clinical research and medical health information. By following you, they're getting an added ability to learn more about what this clinical research stuff is all about and how it can be a benefit to their health. And so that's what I said, move the needle by capturing these folks into your database and continuing to remarket to them. And really this maybe goes a little bit more along the lines of the social media posting, which can be organic or promoted, the email blast that you can do each month, which it can be like a newsletter form where you talk a little bit about research and who you are, but also showcase all of your studies. Now, just for following you, these people are learning about research, and we're helping to educate the public. So remarketing tactics allow you to target and engage with qualified patients. So there are lots of tactics that you can utilize, and this is really reaching out to those people that are already in your database. So that includes those inclusion-exclusion criterion searches, where you're leveraging medical history and demographic information that has been previously coded. And but that I just put in there in parentheses that not everybody does that. So that was one thing I wanted to really make an important point about, If you're just collecting names and email addresses and maybe phone numbers and addresses, you're very limited in how you can remarket. And so having methodologies to, when, especially if you make phone contact with someone, to collect their medical history information, even if it's somewhat cursory, but finding out what their primary medical conditions are, primary diagnoses, medications. You can usually ask those questions in a couple of minutes and code those into your database. And now you have powerful information to leverage for these inclusion exclusion searches. There are some CTMSs out there that you can set up auto coding so that if you're marketing for a diabetes study and a type 2 diabetes study, if someone applies, you can go ahead and have the system auto code them with type 2 diabetes. There's a chance that they applied and they don't actually have the condition, but that's probably a much smaller percentage. And so essentially, if you think about it, now we're collecting hundreds, maybe sometimes thousands of leads of people that are applying for type 2 diabetes studies. And just for applying, even if we never actually get a hold of them by phone, they're going to start getting information from us about type 2 diabetes studies. So very powerful remarketing there. So that would be new study notification emails that come out of those inclusion exclusion criterion searches. I found 150 or maybe 1,500 patients in my database that I think might be likely qualifiers. Let's send a targeted email to those folks that tells them about this new study that they may qualify for. And then of course provide a link within that email and our phone number and whatnot, but the link would drive them to the website where they can apply for the study. And now you have their application for this new study. Mass text notifications. There are systems out there for this where that same subset of folks, you can send them text notifications where they can respond yes that they're interested. This is a much more powerful form of communication over email. Typically with emails, you're going to see very, very small response rates or percentages, oftentimes less than 10% of people respond to email. And I mean, sometimes it's worse than that. Text notifications, you're looking at probably somewhere between 65 and 80+% response rate. So much more effective way to get a hold of folks. And then they can, again, just respond yes, and then that can alert you and your staff to give these folks a call and screen them for the study. The monthly newsletters, which I've already talked about in an email form, but that's just goes out to your entire database. Every month, it's another impression and an opportunity for you to again, spread the word about what you're doing and the studies that are currently enrolling. I can tell you at my site, every month we did one email to our entire database, and that day our recruitment department was slammed, actually for the next several days after that, because we would get hundreds of people applying to our currently enrolling studies. And these are people that are already in our database, but they're following our newsletter and they're going, oh, look, they've got a new study and it's something I'm interested in, and they can apply. Social media, again, non-promoted versus promoted, and then blog writing and distribution. And that's kind of a new topic, but having a blog section on your website where you can write really interesting content and information about what you're doing and the studies that you specialize in, and then sharing that through social media and digital platforms. That's another way to drive traffic to your website and get people interested in your studies. So the non-promoted remarketing, I've really touched on it quite a bit, but just wanted to kind of separate it out that this is really free remarketing. I mean, other than your time or maybe your agency's time to help put these materials together and disseminate them, this is not, you're not actually paying to promote these messages on the platform. So you can be very broad and general, but you can still target on the platforms. And of course, anyone that's following you on these platforms is going to have a first priority to see these things based on the algorithms of like Google and Facebook and Instagram. Remarketing to your database through text and email is affordable and effective. There is a cost to text, obviously the per text fee, but it's negligible when you consider the cost of any other type of advertising and the effectiveness on top of that. Phone remarketing is more time consuming, but there's no advertising cost directly. It's just your staff's time to reach out to folks. So even in that same scenario where you're doing the inclusion exclusion criterion searches of your database, you can send them an email, you can send them a text, you can also have your staff just reach out and call these people, especially if you have a subset even within that group of people that you feel are really highly likely qualifiers. Maybe you prioritize them to be someone that you actually reach out to by phone. And then I already mentioned this too, but keeping your research community in the know of what you're doing. It's part of that newsletter, but it's free and it's just great information. And then one thing that I also wanted to point out is that these tactics can be utilized prior to any SIVs. And so really a lot of these don't have to be study specific at all, but if you do know you have, say, a vaccine study coming or a type 2 diabetes study coming, you could be skewing your messaging towards those particular indications to start gathering even more interest and leads right even before you have your SIV. And I put in here, you can do this so that you can also be the site that has the FBI, first patient in. So that's what we did at my site. We leveraged our tactics well before SIV. So we had patients lined up to screen the day after our SIV. So promoted marketing is obviously more expensive, still very affordable in my opinion overall, but you're basically paying to get a lot more impressions out there. If you just post something organically on your Facebook page and you have 1,000 followers, maybe a quarter of those are going to see it, maybe. That's 250 impressions for free. Except for, of course, your cost to build the post and place it, but otherwise it's free. Now put $50 behind that post, and now all of a sudden thousands of people are seeing that post. You can put a few $100s behind that post, and even more people are going to see it. So that's what promotion is all about. Is it saying I have a message that I want a lot of people to see, and it's people that are outside of my follower network. I want everyone in the community. I can say what geographical range I want it to go out to. I can also put other targeting in there for certain subsets. You know, again, I mentioned gender or certain sorts of interest groups and things of that nature. But you can highly target these things, but you can make sure that it gets out to thousands of people. And so the remarketing aspect is, of course, going to go to the people that are already following you, the people who have liked your pages and who roughly match your IE criteria, those who have visited your website, and anyone who's abandoned a lead form. So you can actually set up remarketing campaigns within these platforms to where essentially if somebody comes to my website, they look at something, but then they click away, we can now start following them around on the web. And you've probably had this happen. I have been a little bit blown away lately because I was looking for a fan motor for my house. And so I was on these websites looking for fan motors. And now every single website I go to, it seems like I've got fan motors all over the webpage. They're remarketing to me. They know that I have an interest in this product, and I actually don't anymore because I already bought one. And so I was able to click and tell Google to stop showing me this ad. But essentially, Google's following me around. Facebook can do that. Instagram can do that. And so when you're working with a company like ImageBloom, or if you have staff that understand these tactics, then not only can you have really targeted advertising that's going out for your studies, but you can also have very targeted remarketing, and that really helps to further increase the ROI that you're getting from these campaigns. It gets a little complicated, I know, but it's a matter of understanding how all these different channels work and how to leverage these types of tactics. All right, poll question number 3. This is our final question. Is it part of your normal practice to reach out to your database of volunteers prior to your marketing spend? So this goes back to what I was saying before, is that you know that you have a budget coming from your sponsor and they're going to give you some money for advertising. Are you waiting till the contract's final until you can spend that money? Or are there things that you're doing well before that to start gearing up for your studies and to be successful in your studies? And so yes, and it works. The other one is we don't have much success with it. And the last one, we don't have a database that provides enough benefit. So Yes, and it works. That's great to hear. I'm so glad to hear that. I guess we all have to be pretty savvy as sites, and so that's probably why so many of you answered that you're doing it. And yes, it works, because I do believe it works. But for those of you, the 33% of you that are saying you don't have much success with it, I would love to know why and what you're doing, and maybe hopefully today some of the ideas that I'm giving you can give you some food for thought, and maybe employ some new tactics to be more successful with that. Because again, for my site, it was a very important part. We always wanted to be the first site up, but really even before that, we wanted to be trying to really line up those folks prior to our SIV. And so maybe something we can talk about at the end of the presentation if you have any questions. So a few remarketing tips. We're getting close to the end of the presentation here, but just a couple of tips to think about. I really couldn't think of more than 3. I probably could if I really just maybe put a little more time into it, but be the first to kick off enrollment and start remarketing campaigns as soon as possible. So we just talked about that. And so I think that, again, for those of you that have tried it and it didn't work, I would try again and maybe try something new, because it can be very effective. But you want to be careful not to over remarket. And so I've had to tell sites to calm down a little bit. We did 1 newsletter a month at my site, and then I've come across other sites that are doing 1 a week. I think maybe that's a little too much, because obviously if any company starts clouding your inbox, you're going to send them to spam, or go and unsubscribe from their email campaigns. So I think making sure that you're finding a good balance where you're providing that value to them and you're remarketing to them, but not to a point that you're annoying them. So keep that in mind, and that's sort of just, you kind of have to use your best judgment, but hopefully with your best judgment you can make sure that you're not annoying people. And then targeted remarketing does provide a greater value to the volunteers. So just another thing to think about too, like the general newsletters obviously are very general, and it has a bunch of studies that may not even apply to them. So there's potentially value there, but there's also potentially very little value. Same thing with even your social media posting and whatnot, that if it's really broad and general, then maybe there's value, maybe there's not. But anytime you're really targeting, in my example earlier of somebody applying for a type 2 diabetes study, and because we spoke to them and we got their information, and now I'm able to send them a targeted email that says, hey, Mr. Smith, based on the information that we know about you, we think you're a good fit for this study. That's a huge value back to Mr. Smith. And so really engaging in some of that more targeted remarketing may be the difference maker between even some of you that say that you're having great success or not great success. Maybe it's because you're not able to target. Maybe your database doesn't have the medical history information, or maybe you're not able to perform those inclusion-exclusion searches and get those subsets of patients and then target them more specifically. So maybe that's one reason why you're not seeing as much effectiveness, is because there's not enough targeting. And then this is my sales pitch slide. Sorry, got to do it. But basically, this is what we specialize in. And so everything I've talked about today, and really so much more, is what we do for sites. It's far less than, I believe, having your own FTEs on site. We can do it remotely as a professional agency and bring you really great results, and really help make sure that all these things are in play for you, and that you're leveraging these tactics to be successful. And so, give us a call just to talk about it. And we'd love to just share how we work and how we can help you guys out. And, maybe you decide that you can do it better yourself, and that's fine too. So that's basically all. I would love to field some questions from you all, and ideas as well. I put ideas in here because I think when it comes to these types of tactics, I'm always trying to keep an open mind about what else we could be doing and some new ways to be successful. And perhaps some of you have done some things that are working, and I'd love to know what they are. So with that, Marina.
Okay, Rick, we have our first question here. Question is, how do you track all your remarketing campaigns?
I might need some help on this one, but I mean, certainly within your CTMS, hopefully you have a lot of tracking mechanisms. Google Analytics tied to your website can give you a lot of data, and then the social media platforms themselves have a lot of reporting as well. So I think, unfortunately, perhaps, unless Marina, you have a better answer, you do kind of have to collate probably some data from these different platforms, and you'd have to have a way to measure it to a certain degree. But I would also say, as a final part to my answer, is it is very difficult to truly gauge ROI of these tactics. You have to kind of believe in it to a certain degree and know that multiple impressions and repeat impressions and remarketing, it's an investment. And so you might hit Mr. Smith 2 or 3 times before he reacts. And then one day, all of a sudden, on the 5th time he sees your message, he responds and he applies. And so, it's not easy to always really gauge how much of this is building up to more impressions and more impressions and more responses and so forth. But Marina, do you have any other thoughts on how you can measure the return on your remarketing?
I think I'd have to agree with you, Rick, on the Google Analytics section of it. I think that tool has a lot of good reports for you to kind of follow and track your return on investment on the marketing campaigns that you are running out there, as well as your CTMS. If you do have a CTMS system, there's a lot of great reports that you can pull to compare your leads to your ad spend. So yeah, absolutely, all of those are really good tools that you can be using.
Great. Okay.
Okay. So our next question is going to be, are there any specific remarketing tactics that work well for business-to-business companies?
Yes, well, and so that's another thing that we do, and essentially, it's a different message. Obviously, I really tailored this webinar to be more about building your patient database, but you're absolutely right. Building your sponsor CRO database to get more studies. Again, some CTMSs have that component as well, and then the same remarketing tactics can come into play, but that's collating leads. That really, it's a whole nother webinar, quite honestly. But so as your monitors come in, getting, or any of the staff at the CRO level or the sponsor level, making sure you have a database to capture all of their names and what company they're with and what their role is, and then retargeting messaging back to them. And that can be a B2B monthly newsletter, which, by the way, I also did at my site. Every month we had a newsletter that went out to all of our sponsor CRO contacts. But there are other ways besides just the people you're working directly with to get additional leads. So I would recommend LinkedIn as probably the #1 B2B platform, where you want to have a section on your website that's really dedicated to showcasing who you are and your capabilities, and really speaking to the sponsors and CROs, and then place ads that are paid and promoted to get those ads in front of the types of folks that you would want to talk to about studies. And then you're driving traffic. You're driving traffic to your website. You're collecting, hopefully, forms from those folks that are interested, or maybe phone calls. But anything under the sun, webinars, excuse me, not webinars, conferences, where you're either have a booth or you have materials that you're sharing and collecting names. But any way you can think of to collect names to build that database, then you can start remarketing to that database. Now, you probably wouldn't use your text messaging for that. You'd probably focus more on an email newsletter type strategy. But maybe you could also do mailers. Sometimes we would come out with a new brochure, a really nice brochure for our site, and we'd print a couple thousand of them and mail them out to our entire database of B2B contacts. Again, monitors, project managers, medical monitors. That actually can get a little bit expensive, and it's almost impossible to measure the ROI of that stuff. But who knows? I got to believe that when you're putting all that information out there to these targeted folks, that it's being seen and it means something. But it is very hard to measure. So I hope that at least somewhat answers your question.
Thank you, Rick. Next question is, what kind of creative drives the most engagement in this sector?
Well, that's a broad question for sure. What I think it's going to be a horrible answer. It depends. It depends on the demographic that you're trying to
Mhm.
reach. So if we're trying to get Alzheimer's patients, we're probably going to target caregivers, and we need ads that talk to people in their 30s and 40s and maybe even 50s. But if I'm looking for moms, young moms for a women's health study, that's going to be obviously a different form of creative and call to action. But I think the bottom line is this, I think in clinical research, we see a lot of really boring, dull ads. And what we specialize in ImageBloom is ads that not only target the demographic, but turn heads. And that's the difference. So that's probably the best answer I can come up with. I could say generally that ads that move, animations, videos, we find better engagement, better response from those. So our design team builds moving graphics and GIFs and things like that. So it's not just a still image. But whatever we have to do to turn ahead,
Mhm.
whenever your ad's going through a news feed, you figure you have maybe half a second to grab someone's attention. So that half a second has to really count, and you need to put something in front of them that makes them stop scrolling for a second to go, what is this? And then hopefully you have messaging and linking and calls to action that really follow up from that point forward. So it's a lot of things that really turn heads and help ads be more effective in this industry.
Absolutely. The next question here we have is, where do you get the content for monthly newsletters?
Well, if you're doing them yourself, hopefully you have someone, or maybe a recruitment manager. It doesn't have to be anything too extensive. It can be a paragraph or two about, maybe something exciting that you're working on, or we would come up with ideas. We'd have little brainstorming sessions, maybe once a month, to talk about a topic that is relevant to clinical research. I remember one of them being the top 10 reasons to participate in clinical research, and then we came up with a top 10 list. It could be, what does it mean to be a volunteer? It could be something to showcase your principal investigator that is working on, a certain area of research, and showcasing their experience and why they're a great doctor and why they're a great researcher. Really, anything in the first part of that newsletter can just be about your site and your staff and research, but not too much information, because again, I think the world moves so fast and people take in content so quickly and they get bored really fast. So I would quickly get to currently enrolling studies, or maybe new studies that just started, and then have a full list of all your studies and link those out to your website and your landing pages. So it doesn't have to be anything too major or too extensive, but it's an impression. You've got your logos in there, and it's your color scheme, and it's got really valuable information, and it's got all your studies. And you can even work with a template, say in MailChimp or Constant Contact, and just modify that template each month with some new information and obviously the new studies. And so keeping a newsletter like this alive each month shouldn't be too big of a project for you to keep going.
Thank you, Rick. The next question that we have here is, do Facebook remarketing campaigns get leads that are more qualified than regular campaigns?
I think that the idea is that I would say I couldn't say for sure, and probably not. I don't think that they're going to get you more qualified leads. They're just going to get you more leads. And so the idea again is that somebody might have clicked on your post or your promoted post, and then they looked at it and then they clicked away. Well, hold on a second. Obviously, this interested you for some reason. Maybe they got distracted. Maybe they were at work and they got a phone call. Maybe they weren't sure. Maybe they wanted to think about it and talk to their husband or wife about it, but there was some interest there. And so What we want to do is give them another opportunity to express their interest. Now, whether or not they qualify is probably the same percentage as if they had applied the first time. But obviously what we want to do is it's kind of a cleanup activity. You have a ton of people that see the ad and respond and apply. You have a whole bunch of other people that see the ad and don't respond. And we want to give them another chance. And that's what remarketing really is all about in that atmosphere. So what I would say is it's a chance to get more leads and improve your ROI, but not necessarily more qualified leads.
Thank you, Rick. And that wraps up all of our questions for today.
Okay, well, we came in 10 minutes early, so hopefully you get 10 minutes back and get something done. I really appreciate everybody's time. Marina, again, thanks for putting this together, and look forward to talking with you all in the near future.
Thank you, everyone.
Stay safe. Bye-bye.